Okay, so more information on this Nutrigen specialty functional lab. It gives you a ton of information and it pretty much puts together a plan for you based upon this patient genetics. So this Nutrigen panel analyzes over 363 genetic variations, looks at these SNPs and your genetic predisposition towards certain things, your trends. By looking at those certain trends, it can then formulate a personalized dietary plan. All right, so you can see here just a little snippet of what these genetic SNPs look like. So we have these genetic SNPs here, and then, what this is related to. So, IL-6 is an inflammation marker, right? Showing based upon this SNP, there's an elevation, right? So we're dealing with an elevation. Correlate that to a possible CRP, which may be elevated. Again, adipose tissue is inflammatory. These two markers may go hand in hand, but based upon their genetics, it does show an elevation of inflammation based upon IL-6. So again, this Nutrigen panel gives you a ton of information. So look here, we're looking at lactose. This patient, for their genetic SNP, shows that they have a slightly elevated risk for consuming dairy. So here's your recommendation. Let's limit dairy intake. Or you can just altogether have a patient eliminate it if you find that it's best. Looking at gluten, checking all of these different SNPs. And then this patient is at a medium risk. So a medium risk for gluten intolerance. So you can make it, as a practitioner, you can make the decision to have a patient to completely eliminate gluten or limit the amount of gluten that they're having. It looks at eating habits, and it's so cool because it looks at fat taste perception. So based upon this genetic SNP, your risk, your ability to sense the fatty taste of foods is atypical. So you may have more of an affinity, or you can taste it more, which you may find that you like it more and you consume more based upon that. So the Nutrigen includes genes of food sensitivity, includes inflammatory markers, weight management, cardiovascular disease, and nutritional deficiencies. So this comprehensive functional profile here, this functional lab, is important because it gives you a ton of information to address your whole patient. So I wanted to highlight this particular slide on sugar preference to show you that, sometimes it's not just a patient really wanting sweet, but it could be their genetic SNP is highly expressed in creating this affinity for the taste of the sweet. So when that happens, definitely you have to be a little more proactive with assisting the patient with reducing the amount of sweets that they're having on a day-to-day. Instead of them having a cookie, maybe they can have frozen blueberries and still be able to fulfill that sweet taste. So again, understanding individual genetic variations can be useful as part of a comprehensive evaluation for your patient. Again, this genetic profile is so important and is such a handy tool in your toolbox because it gives you an overwhelming amount of information to use to create a comprehensive treatment plan for your patient. Now, what do studies report about the use of nutrigenomics tests? So you can know it's not just me that just really enjoy using this test, but what do the studies actually show? So a personalized diet based on nutrigenomics led to both improvement in lipid profile and reduction of inflammation and reduction of adipose tissue. So definitely attributing to also with weight loss. There was also another study that showed after 300 days of follow-up with individuals who followed the results of the nutrigenic tests, results were more likely to have maintained some weight loss, 73%, in comparison to the control group, which is only 32%. So again, this is not a quick fix. This is an overview, comprehensive overview, a guide, dietary guide that a patient can use to not only get weight off and reduce other possible factors, like again, lipid reduction as well as inflammation reduction, but this will get the weight off and keep it off if consistently followed according to the data. We're going to look at some actual reports of patients, and then also looking at how I approach the case versus treatment, and how I achieve success with approaching the case with my treatment protocol. I have a 32-year-old female that presented to clinic with a CC of uterine fibroids as well as obesity. The patient presents with concerns regarding her weight and the impact it may have on her uterine fibroids. Patient is looking for guidance on weight loss. No surgical interventions, no history of cardiovascular disease or family cardiovascular disease. Her labs did reveal an A1C at 5.7, which could indicate prediabetes. She's not currently taking any medications. Initial assessment showed her weight at 231.2. Her BMI was calculated at 33.2, which is obesity. Uterine fibroids diagnosed through a pelvic transvaginal ultrasound that has been causing her some increased discomfort and menstrual irregularities. The uterine fibroids are located subserosal and pedunculated, which could be the causative effect for her menstrual irregularities with the subserosal fibroids. So again, we are looking for a weight loss protocol, right? So that's why I really like to do this genetic test. She agreed she wanted to do the test to get more information. And so what this test revealed to me, based upon her genetics, that she had a negative carbohydrate metabolism. Carbohydrate intake will lead to disruption in cholesterol levels and also increased calorie and fat intake. Eliminating refined carbohydrates is urgent. More to whole grain carbohydrates and reduce the quantity. So you can see she scored very low on that. Same thing for glucose metabolism. She did have some dysregulation, a high risk of developing type 2 diabetes, which kind of corresponds with our A1C that was done in the labs. Fat metabolism, she definitely has a negative burning capacity. It's recommended to decrease the general fat intake. Lipid metabolism, cholesterol and triglyceride levels may show irregular results in blood analysis, especially her LDL, as well as a reduction in HDL treatments would be recommended. Increased cardiovascular risk. So although she didn't have any family history of cardiovascular disease, her current labs are showing within range. Based upon her genetics, she does have a 42.53% risk of developing some type of effect to her lipid metabolism. 66.44% for flavor sensitivity, so she does have a slightly increased flavor sensitivity. So no important impact on the diet is predicted in regards to that, but she can kind of taste her foods more as it relates to this particular SNP. She has more sensitivities for salt, for sugar, etc. Efficacy of exercise. So what that showed was exercise was important and impactful for her weight loss progress. We looked at some of her intolerance risk. So lactose intolerance risk was low, it's in the green. Alcohol metabolism's green, low. Now she does have a risk of celiac disease, so that would prompt me to further investigate that, which we did. And then caffeine metabolism, she has issues with metabolizing caffeine. So the good thing is she does not consume caffeine and no coffee or any caffeinated teas. So we didn't have to worry about that. And there was no risk of fructose intolerance. Looking at her vitamins and minerals, her vitamin B6 was at risk of high, her B12 was high, and then a medium risk of predisposition to dysregulated magnesium levels. So we definitely want to make sure that we are replenishing these deficiencies. When things are in the green, they're good to go. When they're yellow, it's a medium risk. So what I will do in cases of that, we'll go ahead and supplement with either the detox powder, because that's kind of like one of my starting tools. And so that's going to give them the minerals and vitamins that they need to replenish these deficits. So the rest of the efficacy of exercise was on the second page, which did find that exercise, again, would be helpful for her with stimulating weight loss. So increase in exercise is important. Her behavioral genetics and food intake. So what this means is that she does have a possibility based upon her genetics to be overweight. So, and also to have a compulsive intake of food based upon her genetics. So in cases of things like stress or anxiety that would prompt her to possibly consume more food, finding ways to combat that, to decrease anxiety so that doesn't happen. Detoxification imbalances. She has an average detoxification capacity, 86.43, which is not totally bad, but it is average. But this definitely will be supported in supplementation with helping to assist with detoxification. Now, this here is the kind of like just overview of supplements that are beneficial for each detoxification process. So whether it's detoxification phase 1, phase 2, looking at those different processes as it relates to the liver to support detoxification. With supporting detoxification, we also can support the acceleration of accelerating the breakdown of fat. These are just recommended supplements that were listed based upon her genetic SNPs. Does list the top 5 foods according to the patient's needs. And so these are foods that also contain some of the nutrients and supplements, the nutrients that were found in the supplements that they recommended. So it breaks it down into categories, the top 5 vegetables, legumes, etc. I'll let you guys read through that, but it gives those foods that are more beneficial for her. Now, these foods do not show any food sensitivity that she may have, but it is based upon her SNPs and the information that's given what's more important. It also lists the top 5 foods that are not recommended based upon her genetic SNPs. So again, vegetables, all broken down into the different groups. I'll let you guys read through that, but this information was given to her for the foods to avoid. So here it breaks it down to show like what should be the biggest component of her plate when consuming a meal. So 50%, non-refined carbs, as well as 25% proteins, 25% lipids. So if she's following some particular diet, you can modify this. She did participate in intermittent fasting, but she didn't she didn't follow any type of restrictions with her diet. She did continue to consume dairy as well as gluten, but this was just the recommendations, again, based upon her SNP. So looking here as far as physical activities, you can see that exercise is definitely very beneficial for her, but the exercise was more beneficial for improving her HDL, but not so much her body fat. So what I really honed in on and focused on was diet restrictions, and then incorporating aerobic exercise in her day-to-day to also still assist with weight loss. 34.33% doesn't mean no exercise. It just means that it's a lower effect on reduction of body fat. So definitely, body exercise was warranted and needed. Now, it does do a recommendation of calories as far as her place in the obesity class 1 category. 1,000 to 1,100 kilocalories a day was recommended. So for her case, I did recommend 1,200 to 1,400 calories per day. Again, based upon her exercise to reduce body fat and it being that low percentage, it was very important that we focused on, again, a restricted diet in order for her to be successful. So at her 6-week follow-up, she was 11 pounds down, guys, and we were so excited. I was so happy for her. So the weight loss goal that we had set was 1 to 2 pounds per week, which I find to be an effective way to lose weight instead of too much weight too fast, which can be harmful to the body. Patient noted overall increase in energy, and she was super excited for continued progress. At her 3-month follow-up, we repeated labs. Her A1C had lowered to 5.4. Her total weight loss was 22 pounds. She had a decrease in menorrhagia, so her cycles were not as heavy as they had been, and she had noted a decrease in clots as well. So overall, good success.
If you're interested in learning about these factors from a functional and an integrative medicine approach, I invite you to join our Functional Weight Loss Summit, where we're going to, together with several experts, dive deeper into the 5 major physiological factors that lead to weight gain in the functional medicine approach. We're also going to look into the specific functional or specialty lab testing to identify those root causes. And we're also going to look into how to create a personalized treatment plan for your patients. We're also going to cover the clinical application of nutritional, herbal, and probiotic supplements for weight loss from an evidence-based approach with specific treatment protocols. This event is live, so you can ask questions and you get all the recordings and handouts and clinical guides with it. You will also learn how to guide your patients towards better health and function so they can feel and look better. Click on the link below and secure your ticket now. I'll see you there.